Good evening, ladies. Thank you again for joining. For those of you that don't know me, I'm Tracy, the founder of Braca Strong. And tonight we have Dr. John Diaz and Karen Mills, comedian, coming on to educate us about ovarian cancer awareness and what it is to be a survivor, as Karen is a ovarian cancer survivor herself and quite a comedian. I'm enjoying the punchlines for tonight, as it's so important sometimes just to add some light in our conversation. And I'll be here live at Braca Strong today, and we are so excited to open up Ovarian Cancer Awareness Gynecological Month with two experts. One is a survivor herself, and one is a physician. And at this time, what I'd like to do is pass over the mic, and Karen, if you want to do a short introduction, give us a little bit about your background, and then we can go ahead and get started and educate and humor everybody that's on us, as it's so important, as I stated before, is, when we get a diagnosis, sometimes we just all of us step back and then we realize that there's another side to it. So tonight we get to bring both the education and the humor side.
Okay, thank you so much for having me. Yes, I am. I'm a stand-up comedian. I've been a comedian for 28 years, and in 2013, after I was diagnosed with ovarian cancer, then I started telling my story. And of course, I always use humor, no matter what I'm doing, because that is my coping skill. And everyone, people started then asking me if I would speak at events and tell my story. So I kind of started transitioning then from comedian to speaker. I mean, I still do both. I still do tons of straight stand-up comedy, but I do a lot of comedy with a message. And even in my stand-up routines, I didn't know if the cancer would play, because people aren't sure if it's okay to laugh. But then when I tried it in just a regular stand-up show that wasn't like a survivor event or something, so many people came up to me and said, thank you so much for doing that. And I realized that everyone is touched by cancer. So it doesn't have to be at a survivor event. It's the whole world has been touched, either with a friend or a parent or a wife or whatever. Someone knows someone who's been through this. And so I realized that at that time and started even sharing more of my story. But it has been for 28 years my job to make people laugh. And it's a job I take very seriously, because I know the impact that laughter has on our spirit, our morale, and our ability to overcome whatever challenges we may face. And now more than ever, we have to make a conscious decision to look for the humor in life, because there are so many stressors right now. And without humor, I don't know how any of us, would survive it. And, it's really, humor's not hard to find. All you have to do is pay attention. In fact, it's why I became a comedian. Funny follows me. Just the other day, I was in line at the grocery store, and this lady turns and goes, how big would you say a 10 by 13 storage unit is? I said, well, I'm just guessing. But I'm going to have to go with 10 by 13. And I was working down in St. Augustine, Florida, and a friend of mine had gone with me, who also had short blonde hair. And we were out to eat, and the waitress walked over and said, are y'all related? And I said, no. And she said, are you sisters? I said, where did I lose you? And then I heard a man sitting at the very next table ask that same waitress if the Alaskan snow crab was local. She said, I think so.
Why are you picking on Florida?
Okay, believe me, even in my own great state of Tennessee, I stopped at McDonald's. I ordered an egg and cheese biscuit. The girl taking my order asked me, did I want my egg round or folded? Well, I've never been asked that before, but I consider my options, and I said, I'll go with round. She said, we only have folded. Believe me, it happens everywhere in every state. I just happened to hit on Florida there. Sorry about that.
Right?
And I was working in Indiana one time, and it was just across the Kentucky line off Interstate 65. And right there's where the time zone changes. And I forgot to ask where my show was. They're on Central Time or Eastern Time. Well, I had to run into Walmart anyway, so I just grabbed a woman in the store, and I said, "Are you on Central Time or Eastern Time?" She said, "I don't work here." But comedy is everywhere. And the question I get asked the most is where I get my material. And I get it living life. Good or bad, my humor reflects my experience, whether it's something that happens in the grocery store or being diagnosed with cancer, which I was in 2013. As I said, I was on a routine checkup. And the nurse practitioner was examining me, and we were laughing and joking about getting older. And all of a sudden, she got to my abdomen, and all the blood drained out of her face. And she said, "You have a huge mass." She said, "Didn't you feel that?" And I said, "Well, I mean, I knew it didn't matter what I did, I couldn't get rid of my stomach. But I thought it was just weight that I'd gained from menopause." And she said, "That's not fat, that is a mass." So the next week, I was in surgery. And the nurse anesthetist who put me to sleep was my college roommate. And it was great having her there because she later gave me a play-by-play of how it all went down. She said that my doctor had diagrammed me from breastbone to pelvis bone and across. And she had given me enough anesthesia for a 4-hour surgery because that's what he was anticipating. But when he made that first vertical cut, my right ovary came flying out the size of a cantaloupe, my left ovary size of a grapefruit. Turns out my muffin top is fruit salad. And I travel all the time, which means I go through those x-ray machines at airport security a lot. Don't you think that at some point a TSA agent would have pulled me aside and said, "Lady, I don't see a gun, but you're packing a fruit stand. Call your doctor." 4 weeks after surgery, I started chemotherapy, and I played college basketball, so I'm an athlete. I thought I would breeze right through that. That was the hardest thing I've ever been through, and I salute everyone who has slayed that dragon. In fact, I sent a letter to the head of Homeland Security. I said, "Next time you're interrogating a terrorist, forget waterboarding, give him a round of chemo. Check on him in about 3 days. He'll take you to his leader." But on my worst days, my friend Christy would put on Kelly Clarkson, "What Doesn't Kill You Makes You Stronger," and we would dance. Now, when I say that I danced, I mean that I shuffled around the room. I certainly don't want to give the impression that I twerked my way through chemo, or that I was hooked up to the IV going, "Watch me drip, watch me nay-nay, watch me drip, drip, watch me nay-nay." I did not have that in me. But even getting up and moving just a little always made me feel better. And I learned that even when your body is weak, your spirit can be strong. And it made those rough days just a little more manageable. But cancer really has taught me so much. Like, never order a wig on the internet. I ordered the Jamie Lee Curtis Pixie. And what they sent me made me look like Joe Pesci from My Cousin Benny. And right after I had chemo once every 3 weeks, and I just lost my hair, and some friends of mine were having a get together, and they planned it on that 3rd week when I'd feel like coming. And I was getting ready to go, and I put on that wig, and it was horrible. And I see other people tie a scarf around their head and look like a fashion model. When I did it, people asked me to read their palms. I mean, I couldn't get anything to look like a baseball cap. I looked like Barney Fife. I mean, it was terrible. And so I sat down and I cried, and I didn't want to go. And a friend reminded me that your spirit shines through your smile, not your hair. And just that little adjustment in my attitude made all the difference. And instead of seeing myself as a cancer patient, I started seeing myself as a victor over cancer. Of course, the very last hair to fall off my body was Gladys. my devoted chin hair. And when I finished treatment and my hair started coming back, guess who was first back on the scene? I also learned that chemo brain is real. About 3 months after my last treatment, I was on my way out of town. I pulled up to the drive-thru of SunTrust Bank, and the teller said, "How may I help you?" And I said, "I need to pick up my prescription." And the second it came out of my mouth, I realized where I was. I said, "I was wondering if you'd run down to Walgreens and get it for me." I mean, you're the one always bragging about customer service. And one day I was leaving the mall. I had my packages. I go to put my bags in the trunk. I couldn't get the key to work. I keep hitting the remote. It wouldn't release the trunk. I couldn't figure out what is wrong with this key. And then I thought, well, maybe the latch is hung up. And so I took my fist and I popped the trunk. Suddenly the car door opens. A man steps out and goes, "What are you doing?" I said, "Oh, my." I said, "Well, sugar, I brought you a present." I mean, he had a red car. I have a red car. Of course, it's a Mercedes and mine's a Kia. But apparently I can only distinguish colors now. And I have literally been digging through my purse, looking for my cell phone while I was talking on it. I can't find my phone. I don't know what I've done with my phone. And my friend goes, "Well, just talk to me on this one till you find it." And now when I'm driving, if I'm not sure where I'm going, I have to turn the radio down so I can see. Okay. All right. So the truth is, most of that was happening before cancer, but I'm sticking with the chemo story. But one thing that really surprised me about my whole cancer journey is that I thought that I was on the other side of menopause, but removing my ovaries threw me right back in it. And I mean worse than ever. You know, when I was a kid, my favorite movie was The Wizard of Oz. But now that I've gotten older, it's come to have a much deeper meaning to me. I mean, when I was young and the Wicked Witch screamed, "I'm melting," I thought she was dying. Now I know she was having a hot flash. She was going through menopause. That's why she was trying to kill everybody. I've seen the time when I wish I had me some flying monkeys. I'll tell you that right now. And I know why they call them hot flashes. Because when one hits you, you don't care who you flash. And I have decided there could not be very many menopausal women in hell. Because they wouldn't put up with it. They'd band together, overthrow the devil, and get the air turned on. And did you know that the only two species on planet Earth to go through menopause are female humans and killer whales? And I'm guessing they weren't killer whales until after they went through it. I'm sure they were fun, outgoing whales with full lips and a good metabolism. And Dr. Diaz, I always like to take just a moment to share with any men that might be in the room when I'm, presenting the difference between a woman with PMS and a woman going through menopause. A woman with PMS will kill you. A woman going through menopause will force you to take your own life. And you're welcome for that little heads up. Well, I thank you so much for tuning in, and I want to leave you by saying that if you are currently facing this terrible disease or do any time in the future, please remember that your spirit shines through your smile, not your hair. And even when your body is weak, your spirit can be strong. And whatever you do, never, ever, ever Order a wig on the internet. Thank you so much. I wish you all health, happiness, and humor.
Dr. Diaz? Dr. Diaz?
That's tough to follow.
I'm speechless. You have me like at a loss, like my cheeks hurt. This was amazing.
But doctor, you got the brains. I have none of that. So I can't wait to hear what you have to say.
So I went online and I looked up some jokes, gynecologic jokes. And my wife said I couldn't say any of those in public. So I'm not even going to try any of them. But if you Google gynecologic jokes, you'll see what I'm talking about.
I bet.
So
Tomorrow's story post, just so you guys know, Google.
yeah, exactly. Yeah. Thank you so much for sharing your story and the way you said it. It's very funny. And it made me laugh and reflect a lot on so many of my patients. People often say, man, John, you have a really tough job dealing with cancer patients all day. And I say I have the best job, and the women I've met throughout my career, what I've seen in their strength and how so many of them really are able to face this challenge with humor and with optimism. And even on their toughest days, if I'm running late in clinic or, had a challenging surgery, they ask me, how am I doing? And they want to find out if I'm okay. And I'm thinking, you're in the middle of chemo treatment. You want to know how I'm doing. So I'm constantly amazed and surprised by the strength that my patients, who are mostly women, obviously, come with as they tackle this disease. And I think many of them don't recognize the strength that they have. Many of them at the time of diagnosis don't, I think, understand how strong they are, and they're able to overcome these things. And it's amazing to watch, and I'm blessed every day for what I do, and I do have the best job. So thank you for sharing your story. It was very entertaining.
And thank you for what you do. We wouldn't be here without people like you.
I too am looking for myself while I'm on it on a Zoom call, so I share your pain. So it is GYN Awareness Month, and thank you again for kicking off. I think this was a great idea that Tracy had to bring some comedy and some levity to it. And, cancer can be a challenging topic to talk about, but it doesn't have to be a negative talk. And certainly Tracy does a great job of making an opportunity for us to engage and have questions and share our stories, and that's very helpful. So thank you again for doing that. And I was struck by something you mentioned. We are constantly reminded that in the past we didn't talk. Hispanic culture, Abuelita had something, but no one really talked about it. And because of programs like Tracy, and because of the routine that you do, and bringing this out and making sure that we don't have to be ashamed to talk about cancer, and it's something that we're all touched with. 1 in 3 women will be diagnosed with a cancer in their lifetime. Every 5 minutes in the United States, someone is diagnosed with a GYN cancer. So it is very common, and we should talk about these shared experiences, and we should support each other and support our sisters and our wives and our cousins and coworkers and friends. And these things are so important. I think this month is important to bring awareness about GYN cancers, about what women can do to try and decrease their risk, and what we can do with surveillance to try and prevent this, and what we can't do with surveillance, particularly with ovarian cancer. So I think all those things are important to talk about. And I'm happy to answer any questions you guys may have, or anything you guys want to address as far as GYN cancer, screening, any breakthrough therapies. It's been an exciting couple of years in GYN cancer. So I think I'll open this to Tracy and to our audience for anything that they'd want to talk about.
Maybe we can open up with, obviously, this Gynecological Awareness Month, like talking about like the different kinds of gynecological cancers that are out there. Like, we know ovarian cancer, we talk about it. We know there's no early detection. We know, what we're looking to for the future. But for right now, and for moms, for any woman out there who has, a uterus and ovaries, and it's like, what can we help them? How can we help educate them like signs and symptoms of what to look for, when to go to the GYN, forget a family history, just a woman in general, right? Like we talk about survivorship, we talk about people who have a genetic mutation, but what about just our basic educational calls about just the generalization of what it is and what we need to be aware of in our community?
I think the most important thing, and we talk about this a lot, Tracy, is for women to make time for themselves. They're busy with their careers, their homes, their kids, taking care of their elderly parents, that the last thing they leave time for is themselves. And routine health is so important. And along with routine health, not just seeing the doctor once a day, but taking that time out for yourself. Get your exercise, do your walk, your mental health, take your breaks that help. So the most common GYN cancer in the United States is uterine or endometrial cancer. And every year I have to update my stats because every year the number of uterine cancers increases. So several years ago, we had about 42,000 uterine cancers a year. Now we have about 66,000 uterine cancers a year. And the biggest risk factor for uterine cancer is age. So our population is getting older. And the other biggest risk factor is obesity. And our population is getting fatter. And so these things, we can't do anything about getting older, and that's a good thing. We want to get older. But we can certainly do something about trying and live, again, a healthier lifestyle where you're making time for yourself to exercise, to eat well, to follow up with your primary care. So those are two of the biggest risk factors for uterine cancer. And the other one, as far as symptom-wise with uterine cancer, is abnormal bleeding. So a lot of times patients will ignore that sign. Some of my older patients say, well, it wasn't really bleeding, it was just a little bit of spotting. Once you enter menopause, in other words, once you haven't had your menses for a year, you're considered postmenopausal. And any bleeding after that, you should go and get evaluated by your gynecologist, because most endometrial uterine cancer presents with abnormal bleeding. And if we can catch it early, most of the time we catch this at an early stage, and most of the time, a simple surgery like a hysterectomy is all that's needed. So again, any abnormal bleeding, you should report to your GYN and to your primary care doctor.
I have a question.
Of course.
Excuse me, I'm sorry.
No problem.
Oh, no, like people always said to me, I can't believe you didn't have more symptoms. And I'm like, well, I did have symptoms. I was tired, bloated, and I never felt like I could empty my bladder, which describes every menopausal woman I know. So, and my question is, we do with parents and kids and just keeping everything going. We all feel like we're carrying the world on our shoulders. And how do you know between cancer tired and just overwhelmed and exhausted because you're running on empty tired?
Yeah, I think that's a great question. And one of the biggest challenges with ovarian cancer is we don't have any way to screen for it. So doing a yearly ultrasound just to quote unquote check to make sure everything's okay has not been shown to be effective to catch ovarian cancer early. The blood tests that patients talk about to check for cancer cells, oftentimes we're talking about the CA-125 blood tests, which can be elevated in women with ovarian cancer, but is not a screening test. In other words, there are a lot of women with ovarian cancer who do not have an elevated CA-125, and there are a lot of women with an elevated CA-125 who don't have ovarian cancer. Thankfully, ovarian cancer is not very common. There are only about 22,000 cases a year. So part of the challenge in screening is we're looking a little bit for a needle in a haystack. But like you, many women who have ovarian cancer had symptoms. The hard part is trying to differentiate these symptoms from something that's more common and less worrisome, like just some GI upset or your stomach's bothering you, versus something obviously more serious like an ovarian cancer. And what I tell patients is, you know your body best. Listen to your body and be your own advocate. If you go to see your doctor and you're not feeling well and you're talking about these symptoms and they're not really hearing you, find another doctor. Find another primary care that's going to listen to you. Find another gynecologist that's going to listen to you and evaluate you. Because when I was a medical student, which was a long time ago now, it makes me feel old. But when I was a medical student, we used to call ovarian cancer the silent killer because there were no symptoms. And if you talk to a group of survivors like you, they would tell you, oh, I had symptoms. Nobody would listen to me though. So they are symptoms.
We lost you.
Patients that's going to be attributed to something else. Sorry, I said the symptoms are pretty common and they may be attributed to other things, and most of the time that's going to be the case because, again, ovarian cancer is uncommon. But if you're not feeling well and you're not getting, you feel the correct attention from your doctor, be your own advocate and advocate for additional workup. And that's the one thing that I hope is a take home as far as ovarian cancer. Yes, we don't have a way to screen. And unfortunately, when we find it now, we do find it at an advanced stage. But if you're not feeling well, don't take no for an answer. And if your doctor isn't listening to you, then find a doctor that will.
We have another question, Dr. Diaz. It says, how can we make it so that younger folks can be diagnosed much earlier with GYN cancers?
Yeah, that's the goal. You know, the goal would be to eliminate it or catch it early. And so right now, as far as cervical cancer, you know, pap smears or testing for HPV is a great tool to be able to catch cervical cancer early. Additionally, all young women and all young boys should be vaccinated against the HPV virus, ideally before the onset of sexual activity. So, you know, it's recommended as early as age 9. And if you get it before age 15, it's only 2 shots. If you get it after that, it's 3. So really important for vaccination and screening for cervical cancer. With endometrial cancer, like we talked about, healthy lifestyle is a big one. And then ovarian's tough. We don't have a good way to screen, so listen to your body. And family history. So as we talk more about cancers in our family and as we learn more about it, if you have a family history that's concerning for a breast and ovarian cancer syndrome, you know, to get evaluated to see, do you carry a genetic predisposition to this, where we can maybe intervene before a cancer starts or during a pre-malignant stage of this.
You know, when we talk about hereditary screening, obviously that's a whole nother conversation of its own. And we definitely look forward to, you know, having that conversation about, you know, the genetic predisposition and the different mutations that are available. This month, actually, we have a really big talk with Dr. Diaz's colleagues and, you know, addressing, again, not just gynecological cancers, but the hereditary predisposition. So we definitely look forward to hearing more information on that. And if there's anything you want to share, I know that as we talk about ovarian cancer, you know, a lot of women are doing preventative hysterectomies and, you know, questioning, are we doing the right thing by taking preventative action and doing a hysterectomy at a young age? Or what's the next step? And a lot of women obviously are torn between what to do due to menopause and then due to getting the ovarian cancer diagnosis itself and outweighing, you know, your risks versus your benefits, really.
Yeah, I think that's a really challenging discussion, but an important one to have. And I think things that we should remember is patients who undergo a risk-reducing surgery to prevent uterine cancer, endometrial cancer, that is removing the uterus, which has nothing to do with your hormones, and so shouldn't impact your menopause status or not. And in fact, may simplify hormone replacement therapy in the future. The ovaries is a little bit tougher, right? So in order to prevent ovarian cancer, we would remove the ovaries and the fallopian tubes. Obviously, removing the ovaries prematurely puts you into menopause prematurely, and that has potentially a lot of impact on your heart health, impact on your bone health, and impact on your menopause symptoms and, you know, sexual health potentially. So that one is a little bit more challenging, but I think the other important thing is when you look at the studies out there, there's no absolute contraindication for women who do not have a cancer history, but have a genetic mutation to undergo hormone replacement therapy. And a lot of medical oncologists and a lot of gynecologists are reluctant to discuss that option with women. But I think that in the appropriately selected women, you know, it's a reasonable option and one that the studies have shown does not increase your risk of obtaining another cancer. So.
Can you see the questions, Dr. Diaz?
I can't. My feed stopped. If you read them out loud, I'm happy to answer.
Would you recommend someone who has a family history of uterine and cervical cancer, was recently diagnosed with breast cancer, would you recommend tamoxifen? So before Dr. Diaz answers that, thank you for all the questions that are in there. We do not give medical advice. We're here to give information, educate, and support one another. And Dr. Diaz, if you want to take over on that end.
Yeah. So absolutely, the decision on tamoxifen either as treatment or prevention is one that you should have with your medical oncologist. And that's based a lot, again, on what are we trying to treat and prevent? What were the estrogen receptors on your particular cancer? What age you diagnose? So it really depends, and that's a discussion you have with your medical oncologist.
So we're having a lot of questions about testing and getting done early enough. And I think that there's a couple women who carry a genetic mutation and one ovarian cancer survivor that has questioned, getting authorizations for insurance companies, whether you are diagnosed with ovarian cancer and you need a PET scan, that women are running into different complications. Are you seeing that on your side as well?
So it's a challenge, right? There are certain guidelines as far as when imaging is appropriate and what imaging is appropriate. And so again, it depends on your clinical situation. There's a little bit of a maybe false.
Hear me now?
Can you hear me now?
Yeah.
Great. Let's see if that's a little better. So there's a little bit of a false idea that a PET scan, will find cancer anywhere in the body. And that's not necessarily the case, right? So a CT scan, looks at the body and gives you really good anatomy of the body. There's a lymph node that's 10 millimeters or 15 millimeters of the mass. A PET scan does the same thing, except the dimensions that it gives the reads aren't as good as a dedicated CT scan. But a PET scan has the advantage that it gives you like a sugar solution that goes through your body and goes to areas in the body where the cells are rapidly turning over. Therefore, they're consuming a lot of sugar, like cancer cells would be. But it's not 100% sensitive or specific. And so this week, I operated on a patient. She has ovarian cancer. It had recurred, and she was getting treatment. And her tumor marker, her CA-125, which was a good marker for her, was rising. We weren't really seeing too much on the CT scan, so we got a PET scan to see if that could help maybe elucidate what was going on. And the PET scan really wasn't showing too much either. So we just said, listen, let's go to the operating room, let's put a camera in, and we can really see what's going on, because something isn't making sense. We're not seeing much in the imaging, but your marker's going up. And unfortunately, at the time of surgery, we did find that there was more disease that wasn't picked up on the PET scan. So, PET scan is certainly helpful, and it's appropriate in certain clinical settings, but by no means is a PET scan, check for everything or catch every abnormal, tumor cell in the body. So it's helpful in the appropriate scenario, but by no means is a fail-safe test.
I would, if I could, I actually had a recurrence in 2019, and CA-125 has been a really great marker for me. And that's why a CT was ordered, because my CA-125 was elevated. And but it came back negative. But then when they checked CA-125 again, it had doubled. And so then they ordered a PET scan, and it found a spot in my lymph node.
Yeah.
So
yeah. They certainly are useful in the correct setting, but by no means are they a fail-safe for looking for everywhere.
Right.
So it's interesting is like we're all talking and learning more about like scans and knowing, there's no early detection, there's no early screening, right? So our advice, here from Brackish Strong, Dr. Diaz and Karen, maybe we want to talk about some pieces of advice and words of wisdom for women that are listening to tune in to share with their daughters, their families, their friends, because again, if we can't go in and, somebody's bloated and we don't realize, well, it could be ovarian cancer or whatever the situation is, we need to not take that time, like Dr. Diaz said in the beginning, is take that time back and give ourselves that once a month where we just think about our health, or once a week, like if you don't have time, you need to take that time for self-care. You need to stay informed and be your own advocate. And, yeah, sometimes we're all tired of reading articles and stuff, but these articles all have a purpose behind it. And, being able to make a difference in our community to change what cancer and how cancer is treated is our all-time goal. So for any of you listening, please check with your family, check with your friends, talk about signs, talk about symptoms, talk about how you feel. Sometimes we feel like, oh, we're just complaining, but maybe there really is something wrong. Like Karen said, there was a muffin top, there was a fruit muffin in her stomach. That's right. She didn't catch it. I mean, let's really take a step back. Let's really reevaluate who we are and what we have, because our body parts are inside of us and we need them, and we need to make sure that we are educated. And knowledge is power is my favorite saying, and I say it all the time. But when it comes to ovarian cancer and gynecological cancers, it's just imperative. The numbers, the research, there's not enough information. It's not funded. I actually met Dr. Diaz a couple years ago, and when he told me, and I understood what was really truly involved in ovarian cancer and the research and how there's not enough funding. We here at Brock Strong in 2022 will be making a difference for ovarian cancer. Breast cancer is important research, but let's make a difference and really help women. Instead of it getting caught in stage 4, let's find a way. If there's a will, there's a way. We can start data, we can collect all kinds of information, but we need women to come together and share stories and share your stories for us to make an impact on the community.
Absolutely.
So Karen, if you had to share with your family and friends, what are 3 pieces of advice that you would give, like on your general diagnosis, then you had a reoccurrence, you're still standing strong with humor, still wanting to educate and share all your information on your story to be that voice?
Well, I come from the suck it up mentality. When something, if you're tired or something's not right, you just suck it up and keep going. And particularly when you get to a certain age, yeah, you may have to suck it up sometimes, but you also need, as Dr. Diaz said, pay attention. And if something feels off, and we usually know, listen to your gut. We usually know if something isn't quite right. I had, one time I had severe cramps before I went for my routine checkup, and I blew it off. I did what most people would do. I went to WebMD and diagnosed myself with IBS. So don't do that. Seek a medical professional and get checked out, because it's a day in your life to go and either get some reassurance so you can find out maybe what else you can do if you're low on energy or whatever, but at least you have a worry off your mind, because letting it go can be deadly. So just stay in tune with your body, as Dr. Diaz said. That's one of my top pieces of advice for sure. And humor is, my doctor said to me, I don't care who it is, get negative people out of your life so that you can heal. It's that important. And I believe that. So, cut people loose who never has anything good to say. If they stay swelled up like a tick, get them out.
Love it.
Not to be blunt, but that's my opinion.
You know what? That's the way we have to be sometimes. So we have another question. She says, I have minimal stable scans last week, some nodes and lymph nodes. They're small, but how many centimeters does it take where I start to worry? Is surgery biopsy the only way to know malignancy? And then here's the rest of her story. I was diagnosed with ovarian cancer at 29. The symptoms I had been ignoring. And 29. I've been ignoring my symptoms, heavy periods, and dual pain during sex. I lived with it for a long time, before I had it checked out.
Yeah, so there's no right or wrong answer as far as lymph node you get concerned about, especially if you have a diagnosis of cancer and it's something that they're following. You know, we usually call a lymph node pathologic and it's abnormal when it's more than 15 millimeters. But again, that doesn't mean that a lymph node that's smaller than that couldn't harbor something. And certainly we've seen lymph nodes that are larger than that to be reactive. In other words, cancer, they're reacting to something else, other inflammation. So if you have had lymph nodes, something that they're following, they're probably looking for a change. You know, was it 7 millimeters before and now it's 10? You know, when we see things grow is when we get a little bit more concerned. But again, your primary oncologist that's following you would know your history best and would really connect the dots to see. But if you force me to give an answer when it's more than 15 millimeters is when we call it pathologically abnormal. And if I'm trying to enroll a patient on a clinical trial, her lymph nodes have to be at least 15 millimeters to get enrolled. So sometimes when I have patients and, you know, there's an 8 millimeter lymph node and what do we do? Especially in the setting of recurrence, you know, I tell them, listen, even if I wanted to, I couldn't put you on a clinical trial. So we're not ignoring this lymph node. We're going to follow it in short order and see if it changes. But, you know, try not to put too much stress or emphasis on a 7 or 8 millimeter lymph node. But yeah, pattern or change is what we're looking for over time.
You brought up a really good point, and I want to touch on it before I close out with you guys in a couple minutes. I want to talk a little bit about clinical trials, Dr. Diaz, and maybe you can talk about how your center, first, I guess we should say, has a Broward Center and a Miami Center. And maybe if you just want to talk a little bit about clinical research that you handle over there and open up to our women who are local in our community. Obviously, as we know, you don't have to be local to participate in a clinical trial. But I am for clinical research. I think that the advantages of helping yourself and helping the community and where technology has gone, I think has made historical changes. And if you wouldn't mind to just maybe talk a little bit about clinical trials and why they're so imperative and how it can actually maybe help our patients who are diagnosed or who later get diagnosed in life.
Yeah. So, you know, one of the many hats I wear is I run the clinical trials program for the GYN Oncology Service. And as you said, we have sites in Miami and in West Palm Beach. So we are across the Tri-County area. And, you know, clinical trials are so important. How we advance the science. In the past, you know, kind of a sad joke or running joke in South Florida. If you got sick, you got out of South Florida, right? You went to New York, you went to Boston, you went to Texas. And that works for people who can afford that, right? But most of us can't afford to leave the area. And so certainly most of the people in South Florida need to be treated by the physicians and the resources here. And so that was one of the things that really motivated me to get involved with Miami Cancer Institute and bring the research offered at Sloan Kettering down here through our alliance membership with them, and also cultivate our own research program. So we currently have phase 1 clinical trials, phase 2 trials, as well as phase 3 trials. I have my own investigator-initiated trial for cervical cancer, really built a robust portfolio over the last 5 years so that all women in South Florida have access to cutting-edge technology, to novel therapeutics, and it's not just those women who can afford to leave the area to have access to this. So I think it's really changed healthcare for women in South Florida for the better. We know that women who are on clinical trials, even if that trial turns out not to be a positive trial, in other words, the drug turns out to work, do better, in part because usually people who are involved in clinical trials tend to have an additional level of expertise in their field. And then you have a whole team. It's not just the physician and his nurse, but the whole clinical research team. They're very rigorous or rigid follow-up when things have been done, timing a CT scan. And so again, we know even if your trial isn't a positive trial, women involved on clinical trials do better than those women who are not in clinical trials. So that was a big push, part of our mission with Miami Cancer Institute down here in South Florida to improve the care for all women. And I think we're well on our way to doing that. Last year, they released that we were the #1 choice for new cancer diagnosis in South Florida in only 5 short years. And so I think that's great, and I think we're making a difference. But we have a lot of challenges. GYN cancers are one.
Are we gone?
Is it going?
Oops, I think we're having some technical issues.
Hey,
Are you back, Dr. Diaz?
I cut
Yep,
out.
go ahead.
So I was just saying that GYN cancers are some of the least funded research cancers in the United States. And so, bringing awareness to that, making sure that funds are allocated to this so that we can continue to improve the outcomes for women with GYN malignancies.
Perfect. Well, thank you so much for sharing that information. As I always tell you, I'm a huge advocate of clinical trials. And Karen, thank you so much for coming on and sharing your story and your humor. It was amazing seeing you via computer for now, right?
Oh, well, thank you so much. It's been my pleasure. And if I hate to detain you any longer, but can I ask you one more question,
Of
Dr.
course.
Yeah,
Ask away.
no, I'm very concerned on aging well. And so having had everything removed and not being able to take any hormones, I mean, how much can I build muscle?
Yeah, I mean, I think, and again, I'm listening to you for the first time, but you look great. So,
Yeah.
whatever you're doing.
The filters.
Yeah, whatever you're doing. But it's so important, to continue to remain active. Weight training is important, especially, thin white women are increased risk of osteopenia and osteoporosis, particularly if you can't take estrogen. So weight training is very important. Calcium supplementation and vitamin D. So all the things are important. And then making sure proper nutrition, protein shakes are not just for young weightlifters, making sure you have a protein intake, be it either through supplements in a shake or if you can get enough protein through your diet to ensure to give yourself the building blocks for muscle. It's important.
And not to interrupt you, but I'm not overweight. I just am so frail in my little arms.
You look strong as ever over there.
I need some strength. And so for a protein shake, what kind of protein? Because there's so many different kinds, and sometimes you hear don't do soy, and I just don't always know.
Yeah, and so that's a great question. There's different data out there as far as what is the best protein to help, and it depends on what you're trying to do. So whey protein, WHEY protein,
Yep,
is a good protein to get to help supplement your protein. Different whey products out there on the market. They're now organic whey protein supplements, and you can do this with almond milk if you want to limit your dairy, if you're able to take dairy. And again, that's a good way. A scoop of that will give you 25 grams of protein. And it's a good way to help supplement because I know sometimes it's difficult to get enough protein in your diet. And you don't have to get, whey protein at the GNC or online, but you can also get, Ensure. Those now come in with 20 grams of protein in those Ensure shakes, which is enough to, again, help supplement what you would need. And the other thing is, dedicated training. It doesn't have to be, going to the gym and doing heavy weights, but setting aside time. And for some of our older patients, they have programs for functional exercise online and things that help them develop some of their functional muscles. So it's good, to do bench press and work out things like that. But functional exercise, particularly as you get older, is very helpful for your balance, stability. But it's really, really important to maintain activity. We have a great cancer rehab at our center. And I send most of my patients to go, I guess, at least initial evaluation. And certainly women who are a little bit on the frail side, we're trying to get them strong for a clinical trial. I might have them go see our cancer rehab while they're on treatment to make sure if we need that option in the future, that their performance status is well enough that they can get onto these clinical trials. So very, very important to exercise, including weight training. Again, we're not trying to get, like The Rock, but it's important. And then supplement. Make sure you give yourself the building blocks so you can build that muscle that you need.
Okay, thank you so much. That's helpful.
Yeah.
Perfect. Well, Dr. Diaz, as we close out tonight, I'm going to ask you first if you can readdress signs and symptoms, right, of ovarian cancer, And then what your advice would be as a physician to women that you see on a daily basis, either receiving this diagnosis or as a survivor, a caregiver, a friend?
Yeah. So that's more than 3 questions, Tracy, but I'll see what I can about answer. So as far as signs and symptoms, again, abnormal bleeding, see your GYN. If you're not feeling well, and again, most of the time this is not going to be, like I said, thankfully, a woman's risk of developing cancer is 1.7% if you don't have a like a genetic mutation or something like that. So it's really, really uncommon. But if you're not feeling well, if you're having pelvic and abdominal symptoms and you don't feel that you are getting the appropriate attention from your physician, find another physician until you feel satisfied that it's been worked up. And maybe it is just a little GI or a little diverticulitis, or maybe you have a little bladder prolapse. Fine, great. We've ruled out something more serious. And then, sorry, Tracy, what was the last one as far as?
What's your advice would be to your friends, family, and patients? Like for Ovarian Cancer Awareness Month, is you deal with this, you sleep it, you live it. What is your biggest advice that you'd like to share with everybody that is the takeaway from today? Because I open this month with you and Karen, as it is a true pleasure. And I know that the knowledge is there. And we need to take this message and keep conveying it. And I'm going to replay it and I'm going to replay it. And I want everybody to share this message. Let's be the difference in ovarian cancer. Let's help make that difference.
So going back to screening, like I said, be your own advocate. We don't have any effective screening, but that doesn't mean we can't make the diagnosis. And then I think once the diagnosis is made, this changes your life. And I think it's very important that you be treated by a physician who specializes in ovarian cancer, in a high volume center that has the team to perform the correct surgery for ovarian cancer, which is one of the most important prognostic factors. And then a place that has all the support, not just surgery and chemotherapy, it's nutritional support, it's appropriate genetic evaluation, it's psychological support. Like we talked about, cancer rehab, alternative therapies to help you with your symptoms, acupuncture, things like that. And we really need that entire community of support to really optimize your outcomes and make sure that you can get through this and successfully complete your treatment with minimal toxicity and go on to become a survivor of ovarian cancer. And so I'll close this last thing. I saw a patient Monday who was treated by a very renowned center here in South Florida for ovarian cancer. And she just wanted to come and see, everything being done correctly. And I agreed with everything that she had done as far as the right surgery, and the surgeon is excellent, and the right chemotherapy. But I was a little surprised to see that she had not been offered, which has been standard of care for ovarian cancer for years now, and is NCCN guideline. And again, this came from a very famous center in South Florida. And I was a little surprised that her tumor hadn't been evaluated for certain markers we look for maintenance therapy. And she was older and a little bit frail, and I was surprised she hadn't been referred for evaluation for physical medicine and to help her with some of her fragility, when there was a very good fragility index for an older patient with cancer. So she got the right surgery, she had the right chemotherapy. It was all those other little things that had direct impact on her care, genetic testing, potentially impact on her family, that wasn't done. And I got to tell you, I was a little bit taken aback because, again, she came from a very good center in South Florida. And so I was surprised. So if you face this diagnosis, again, I would encourage you to be seen by people who this is what they do. This is what their priority is, a center that's dedicated to that. Because we have the data that patients treated in high volume centers do better than those patients who are treated in places that maybe don't specialize in ovarian cancer.
Well, perfect. Thank you again so much both for joining us this evening on Opening Up Ovarian Cancer. For those of you that are listening that have not bought your t-shirt, purchase your t-shirt today for ovarian cancer, as we are going to be giving back to ovarian cancer research at the end of the month. And we're super grateful for your support and dedication. I hope everybody enjoyed this evening, and it was a pleasure having you on. Thank you.
Thank you.
Thank you. Thank you, Tracy, for all you do.
Thank you.
Thank you.